Why a total knee replacement? The knee joint may become damaged or diseased, usually from age-related use and depreciation. A total knee replacement is a surgical procedure to improve the movement of the knee joint. A total knee replacement alters the skeletal system, cartilage, and ligaments of the knee joint. The affected structures include the times menisci, times anterior cruciate ligament, times femur, times tibia. Surgical positioning. Beginning the surgical procedure, the knee joint is placed in the flexion position. An incision is made through the skin. Retractors are used to protect the medial longitudinal ligament and the lateral longitudinal ligament. Inside the patella tendon, the patella is moved laterally out of the way. Removal of the damaged portions of the knee joint. Before replacing the knee joint, the damaged portions of bone, cartilage, and the ligaments must first be removed. 1. Guides are placed into the femur and tibia. 2. Using the guides, the saw blade removes the portion of the damaged bone of the femur, tibia, and patella. 3. The medial meniscus, lateral meniscus, anterior longitudinal ligament, and posterior longitudinal ligaments are removed with the damaged bone. Insertion of the prosthesis. The damaged bone is replaced by metal or plastic components. The tibia and femur are surfaced with metal, with a spacer component between. The prosthesis protect the bone, while increasing mobility of the knee joint. Post-surgery. After the total knee replacement surgery, the knee joint will be able to flex the leg with less pain and more mobility.